परत एकदा सगळ्यांक चवथीची परबी. आम आदमी पार्टीचे मेन फुडारी बरेचशे हांगा जमल्या. म्हज्या उजव्यान हांगा रामिरो मास्करेनस आपाचो लिडर, आमचो साउथ डिस्ट्रिक्ट कन्व्हिनर रॉडनी बाब आल्मेदा, सगळ्यांच्या वळखीचो तो प्रदीप पाडगांवकर, हांव एल्विस गोम्स. आमचे मदीं मेडिकल डॉक्टर आसा डॉक्टर मारियानो गुदिन्यो, आमचो पार्टीचो फुडारी. तसोच आनीक एक फुडारी राहुल, आमचो राहुल मांबरे. तसोच नॉर्थ गोवा डिस्ट्रिक्ट कन्व्हिनर सुनील बाब सिग्नापूरकर आणि आनीक एक फुडारी आमचो मारियो कुर्देरो. तर आमी कोविड ही जी महामारी आहा तेजेर खूबशीं सरकाराक सजेशनां दिल्लीं आसा. मुखेलमंत्र्याक आमी मेळून सुद्दां भासाभास केल्ली आसा. आमी कांय टिकाय केल्ली आसा, कन्स्ट्रक्टीव म्हणपाक हरकत ना. आनी मजगतीन सगळ्यांक खबर आहा की गोंया ग्रीन झोन पासून आज केसी कितल्यो वाडत आसा, कितले लोक अनफॉर्च्युनेट म्हणपाक हरकत ना, कितले लोक मरताय बी. आणि डेली एक 4, 5, 6, 7 मरप म्हणल्यार एक न्यू नॉर्मल जाला की काय, असो आम आदमी पार्टीचो आज सरकाराक प्रश्न. कॉमन मॅन जो आसा ताका बरे भशेन सुविधा मेळना. आमी पळयला फाटल्या दिसांनी जे VIP जावं VVIP जे पॉझिटिव्ह जाल्ले तांकां विशेष प्रायव्हेट हॉस्पिटलांनी तांकां ट्रीटमेंट दिल्लो वता. आणि ऑल इंडिया इन्स्टिट्यूट ऑफ मेडिकल सायन्स हांचे सुद्धा एक पंगड गोंयचे डॉक्टरांक घेवन मेळटा आणि VVIP ची तपासणी जाता. मणिपाल हॉस्पिटलान हांगा पणजे दोनापावल वाटेर वयता आसतना त्या एम्साच्या पंगडाक गोवा मेडिकल कॉलेजीन सुद्धा भितर व्हरून परिस्थिती कितें आसा ती कोण दाखयना किंवा तेंचे कडल्यान एक सजेशनां घेना. इतले पयस हांव जर डॉक्टर बरे एक्सपर्ट डॉक्टर येता गोंयांत, कोविड हॉस्पिटलान सुद्धा तांकां व्हरपाक कितें प्रॉब्लेम आसले होय प्रश्न आम आदमी पार्टीक पडला आनी सरकाराक विचारता की कॉमन मॅनाक असोच सोडून दिवपाचो की काय. दिल्ली मॉडेल जो आसा ताचेर तुमकां सगळ्यांक खबर आसा की एक आज देशभरान आनी इंटरनॅशनल लेवलाचेर सुद्धा ताची भासाभास जाता की बरो सक्सेस तांकां मेळ्ळो आसा म्हणून. काल चवथीची परबी दिता आसतना गोंयच्या लोकांक अरविंद केजरीवाल चीफ मिनिस्टर ऑफ दिल्ली हाणें एक ऑक्सिमिटरा बद्दल, ऑक्सिमित्र कशे आख्या देशान पावतले ऑक्सिमिटर घेवन ताचेर कांय आपली प्रतिक्रिया दिली. आनी एज अ फॉलोअप म्हणून आज गोंया भितर आमी वो ऑक्सिमिटर ड्रायव्ह आज लॉन्च करता. ऑक्सिमिटर घेवन जे वयतले तांकां ऑक्सिमित्र म्हणटले. ते लोकां पर्यंत पावतले. कशे पावतले? जायत्यो वाटो आसा पावपाक. जे खरेंच आतां आयसोलेशनान आसा, होम आयसोलेशनान आसा, तांकां सुद्धा हो ऑक्सिमिटर कसो पावोवपाचो जांकां शक्य ना. कित्याक हांगा गोंयच्या सरकारान जो होम आयसोलेशन करता ताका घेवपाचो फर्माण मारला ताजेर, म्हणजे ताणें तो घेवपाक जाय. वेरेज अरविंद केजरीवालाच्या सरकारान हे सगळे उपलब्ध करून दिल्ले आसा. कोणाक गरज आसा तांकां ते व्हरून पावयता. ते तितलेंच न्हू, इवन गॅस, ऑक्सिजन गॅस जाय पडलो जाल्यार सुद्धा तेची वेवस्था केल्ली आसा. हांगा ते कमीपण पळोवन आमी आज कोणाक ब्लेम करिना, पूण ही जी स्थिती आसा ती कशी ताका आमी कशें फेस करपाचें सिट्युएशन, कॉमन मॅनाक कसो सांबाळपाचो ह्या उद्देशान गोंयच्या लोकां मुखार आमी हो ऑक्सिमिटर आज घेवन येता. आमचे व्हॉलेंटियर जे आसा ते व्हॉलेंटियर आमचे हे सगळ्या वाठारांनी वयतले. गरज पडटा ताका हे ऑक्सिमिटर वयल्यान ताचो ऑक्सिजन ताचेर टेक्निकल थोडे आमचो दोतोर सांगतलो एक्झॅक्टली मेडिकल सायन्स जे आसा आनी ऑक्सिमिटरा वयल्यान कितें जाता बरेपण ते तो सांगतलो. पूण ऑक्सिमिटर पावोवपाचें काम आज जे हातान घेतलां आम आदमी पार्टीन ते सगळे गोंयभर पावतले आनी शेवटी जो आम आदमी आसा गोंयचो ताका हातूंतल्यान कितें तरी बरेपण मेळटलें ही आशा धरून हांव आमचो मानादीक जो दोतोर हांगा आसा मारियान गुदिनो ताच्या हातांतल्यान हाचें उद्घाटन जावचें अशें विनंती करता. सो दोतोर आतां हें उगडून एक डेमॉन्स्ट्रेशन करतलो आनी मागीर आपली 2 शस्त्रां सांगतलो. हे पळय दोतोरान ऑलरेडी ग्लव्स घातल्या. कांय लोकांचो म्हाका आमचेच व्हॉलंटियरांचो प्रश्न आसलो हे यूज करता आसतना भिवपाची गरज आसा की काय. आज म्हाका सांगूचें दिसता की भिवपाची गरज कांयच ना. वेवस्थीतपणे हो ऑक्सिमिटर यूज केल्लो वतलो. पयलीं जे बोट आसा मदले बोट तो सॅनिटायज करता. हो सॅनिटायझर लायल्या उपरांत मातसो सुकपाक कसो दवरपाचो पडटा कित्याक सारकोच ओलो आसपाक जायना. हें आतां म्हजें बोट जें आसा तें सॅनिटायज जाल्लें आसा आनी हें आतां बोट ऑक्सिमिटरान दोतोर घालता.
ऑक्सिजन लेवल 98 बरो आसा. नॉर्मल.
हितून
82%.
कितको आसोंक जायना डॉक्टर?
70 to 80. Oxygen level should not keep coming down. More than 90 जाल्यार मातशें मॉनिटर करूंक पडटा. Now this level is very good.
सो हे काडले उपरांत परत बोट सॅनिटायज जातलें. आनी that oximeter is safe for use by next person. So this is basically the method that will be followed. आनी हाच्या पासून कोणाक कांय प्रॉब्लेम आसचे ना. हो जो इंस्ट्रुमेंट आसा अदरवायज ऑल्सो नॉर्मल आमचो फिजिशियन आसता तेजे कडेन आतां आसताच तो. पूण ह्या टायमार मात सॅनिटायज करपाची गरज पडल्या कित्याक ह्या कोविडाक लागून.
Also the oximeter sanitize करता मागीर यूज जालो म्हणटो. Now once you it is the thing it is kept back in the now coming back to the oximeter. कित्याक आमी यूज करता कोविड जाले म्हणटच आमचे ऑक्सिजन लेवल्स फॉल देंवता and it is known as happy hypoxia. Happy म्हणजे पळय आमकां कितें जाता ऑक्सिजन लेवल देंवले म्हणटच आमकां सारकें फॅटीक जाता टायर्ड जाता. म्हळ्यार कोरोना व्हायरसान देंवले म्हणटच न्हू तुका पडना. दॅट्स वाय इट इज नोन एज हॅपी हायपॉक्सिया. दिस लेवल इज व्हेरी इम्पॉर्टंट टू बी टेस्टेड. आतां तूं कोरोना व्हायरस टेस्ट पॉझिटीव जालो आनी जर तो हें ड्रॉप जावंक लागलें इट्स गोज 80, 70. Then 70 means you cannot, if you are home quarantine, isolated, तुका घरान रावूंक जावचें ना. तुका इमिडियटली शिफ्ट करूंक जाय टू द हॉस्पिटल. ऑक्सिजन लावपाक पडटा. एमर्जन्सी एम्बुलन्स हाडल्यार तेंकोण एम्बुलन्सा ऑक्सिजन जाल्यार इमिडियटली लावपाक पडटा. बिकॉज इफ इट ड्रॉप्स टू 60 and then you can have a problem, you can have a fatality. So this is very important for a person who is home isolated and who is tested as coronavirus positive. आमकां कळना आनी कोरोना व्हायरस जालें यू मे नॉट हॅव एनी सिम्पटम्स बट ऑक्सिजन लेवल्स फॉल जालो जाल्यार इट्स अ व्हेरी डेंजरस. And most of the things come into lung goes into some problem, goes into fibrosis, goes into some changes and all. So that is very, very big thing in coronavirus. So that thing we have to take care. And now as Elvis Gomes has already told you how we are going to go with this drive. We are going ahead now as per there are different ways how we are going to reach to the people. But one way which we thought is, since the coronavirus cases are monitored as PHC wise, we are going to go by PHC wise. Even home quarantine via PHC wise. So each PHC is responsible to have the names of the people who are home quarantined. And then what happens to this is each of the A&M nurse who is in charge of that area where the person is home quarantined has to have mobile number of that patient, monitor the patient, ask how is he and all. And most of the time, being poor or they cannot buy, they don't have oximeters. So this oximeter is going to reach to their health. And they can monitor themselves immediately if the oxygen level starts falling down. They have to inform the nurse, and the nurse will inform the doctor will call the ambulance to be carried to the hospital. Now, how we are going to work out that we have already decided. Whoever PHC has got too many cases, they will be given more oximeters and everything will be monitored. We have a lot of plans how to reach to the people, and this is a wonderful thing which Aam Aadmi Party has come to distribute to the people to take care of the COVID cases. Thank you.
Besides that, ये सगळ्यांक खबर आहा, this is a infrared contactless thermometer. हाजेर कांय सांगपाची गरज ना आनी दिवपाची गरज ना. This is very safe. So yes, so that is how we are going to reach out. There are various ways. गावागावांनी सुद्धा by even door-to-door contact also will be reaching out through our volunteers. जाका मातशे सुद्धा symptom आसा, that person is very important to make use of this. So that is how the person in advance comes to know where he stands or where he or she stands, and then can be advised to take further medical help. Thank you.
तुम्ही आता म्हटलं बॅनराचेर बरयला आम आदमी पार्टी ऑक्सिजन टेस्टिंग सेंटर. हे टेस्टिंग सेंटर म्हटलं तुम्ही सगळ्या गावांनी टेस्टिंग सेंटर आम आदमी पार्टी आपले डॉक्टर्स आपले नर्सीस दवरतले टेस्टिंग
ना. आता डॉक्टरान सांगला ते भाशेन this doesn't require any expert nurse or doctor. This can be done by common man also, provided these precautions are taken. So we will be supplying our volunteers with the sanitizer. Volunteer will be wearing gloves. Volunteer will also be wearing this shield. Then even in some cases where we know that a person is already tested positive, there are going to be PPE kits also, which the volunteer will wear. So अशें करून ते in a very safe manner it will be reached to the public.
Okay, that means Aam Aadmi Party will be going door to door, and
That is also
or
in the process that some areas they will be going door to door. Whoever needs the service will come. In some places there will be a testing center. You understand? And mobile number of that particular volunteer will be told to the people in the locality. So anyone who needs at any time can contact that volunteer, and that oximeter will be reached to that particular person.
okay, and just one more thing. Other than oxygen level low, what is your second thing?
एक्झॅक्टली डॉक्टरान सांगला ते भाशेन ऑक्सिजन थ्रेशोल्ड लिमीट जे 90चे सकयल जर पडत जाल्यार मेडिकल तेंचे हेज्या प्रमाणे देन यू हॅव टू रियली टेक मेडिकल हेल्प. मेडिकल हेल्प मीन्स दॅट
That Aam Aadmi Party will give.
we will advise. No, see that beyond that it is not within our means, but we will advise the patient to take further medical help. We will contact that particular medical establishment of that locality that look, here is a patient whose readings are falling below 90. Then it is for them to immediately.
म्हाका सांग सर ऑक्सिजन लो मेळोन म्हणजे तो कोविड पॉझिटिव्ह.
No, doctor.
Then
No, oxygen low doesn't mean it is COVID passage. You may also get in different other lung problems. But see, what happens is when you are tested positive, the reports are already there. You have tested at the Physio hospital or anywhere. So once you are tested positive, the names of yours goes to the respective primary health center, which is under that jurisdiction. So once that name is there, then that person has to be monitored. Say one family member is there. So the oximeter will be given to that family member. The family member, all the family members, there's a possibility that others also may get. So once it is taught to them and this instrument is given to them, they can test their oxygen levels and even whether they have temperature. So if they find that the oxygen level is going down, then it's the duty of these people to inform their primary health center or the doctor concerned of that area, who has to arrange. This network is already set up. So they have to inform the doctor will inform the ambulance, and ambulance should pick them up to admit in the hospital.
Okay, you mean you will be giving every COVID positive patient that oximeter now?
Whoever needs it, because see, there are people who must have bought it also, but there are people who cannot afford. So those people we will assist. Secondly, very important is, Goa has a large population. How many oximeters would we be having to reach out to so many people? The better part is, I had made a small appeal earlier when Mr. Kejriwal had announced this idea. I am very happy to inform. म्हजे कडेन खूब नांवां आसा, पूण सगळ्यांची नांवां घेवपाक आतां टायम ना. पूण आमचे कडेन अशे दोन व्यक्ती आहा, रोमाल्डो रेगो फ्रॉम नुवेन आनी जासिंतो गुदिनो. ह्या दोगांनी मेळून आमकां ऑलरेडी असले 70 ऑलरेडी स्पॉन्सर केल्ले आहा. बाकी बरे मागपी, बरे कॉमन मॅन 1, 2, 5, 3 अशे खूब लोकांनी स्पॉन्सर केल्ले आहा. जितले आता तुझा क्वेश्चन आन्सर करता आसतना जितले लोक आनीक फुडें येतले हे असले आमचे कडेन दिवपाक, तितले आमी लोकां पर्यंत आनीक पावंक शकतले. म्हणून म्हजो आनीक एक तुमच्या हितूंतल्यान मिडियमांतल्यान एक अपील लोकांक की असले तुमी डोनेट करचे, स्पॉन्सर करचे ह्या लोकां खातीर.
Sir, it's a very great initiative which Aam Aadmi Party have taken. But what made it to take such decisions? Aam Aadmi Party has no confidence in the government, or the health minister is failing somewhere?
See, that is not the thing. Precisely, it is the success of Arvind Kejriwal's Delhi model that prompted that it should be done in other states too. In that model, this was a very important ingredient of that model, I can say, whereby home isolation, that was the first government that was advising home isolation to put so that load on the official system is reduced. That is how they succeeded. They kept people at home, but they made all the provisions. They gave them oximeter. If required, they reached out oxygen cylinders. Then continuous guidance was given to them through a medical establishment, and due to daily monitoring of the patient, many of the patients would recover at home only.
The performance of the Delhi government is okay. My question is, Aam Aadmi Party has taken a very good initiative. No
I'm coming to that. Now, why in Goa? Why in some other states also? Because by doing this, now we are the common men, we are the people at large. How we can contribute to improve this, what is already there? So it is our initiative that you can take it either way. It is help to the existing system. Now how that existing system is functioning, at what level it is, I don't have to overstate what it is. Still, there are large number of cases who remain unattended. This is a preventive measure. If you know somewhere in advance that there are problems because your oxygen level is dropping, it may be a small step, but it is a big leap for a common man who would later face problems. So this can also prevent subsequent problems. He can take medical attention. If you ask me, yes, Goa government has not performed to the desired level. And this I have said in the very beginning, that we have brought it to the government's attention. We have given several instances how other states like Delhi have performed on this front. Now, if they don't want to listen, if they don't want to buy at regular prices, if they want to buy at inflated prices, what can be done? We can only highlight. Beyond that, we cannot do anything. But this is a positive contribution from the Aam Aadmi Party.
So are you happy with the testing done in Goa?
Testing is falling short, and we have said it time and again. I don't want to say it again and again. Mass testing, I have been talking about one place called Kunkoli, from where I come. The industrial area there, it had become almost a big transmission zone. Least we were expecting from the government was swab collection. Forget testing could be done. Even that simple facility was not made available. It is still not made available. So, ani कितें म्हणून सांगतलो? स्वॅब कलेक्शन जर त्या एरियान जंय ऑलरेडी कम्युनिटी ट्रान्समिशन मेळ्ळें खुबश्यो केसीस मेळपाक लागल्यो दॅट कुड नॉट बी अरेंज देन वॉट आर वी टॉकिंग सो द लिस्ट दॅट वी एक्सपेक्टेड इज स्वॅब कलेक्शन ते जायना सो एनीवे पळया आतां देव आसा आमचे कडल्यान
So it is said in heard that some private hospitals are charging lot of money for the COVID patient. Some hospitals are charging up to the extent of 1 lakh down payment. How is it for it?
I said it, VIPs are getting treated in private hospitals, some other people are getting treated in private hospitals. We are talking about a common man. How would the common man afford such kind of expensive treatment which you are talking about? So our demand is, this is not a making of anybody. It is a pandemic. So this is the time the government has to help the common man and there should not be any burden on that person, nor his family. आता हे exploitation जे जाता, I am not very sure, but if you are saying it is happening, then it is very bad. It is sending a wrong signal. VIPs have already sent a wrong signal that they are somebody special who should be treated differently than the common man. Aap Aadmi Party stands for the welfare of the common man.
So Manas, how you say about the plasma and the ventilator?
What exactly you want?
About the ventilators are enough and the plasma.
I feel the ventilators are not enough. I cannot comment how many ventilators are there. But the plasma therapy it seems to be working well. And because the results are, it's showing some results.
And plasma therapy, for your information, was started in a big way first by Delhi by the Kejriwal government, and they called on a lot of people who got cured to come forth and give their plasma. Thereafter, it has been followed here. If it is working well and good, but as doctor has said, and even in our knowledge, sufficient number of ventilators are also not there. Pahili I सांगले that there was never a comprehensive plan before the government of Goa. They had not projected how many cases would be there in so many months or so many days. Unless this comprehensive plan was there, this projection was there, this anticipation was there, it was not difficult to manage this. It was difficult to manage this. This is what is happening now. There was no anticipation of what would happen in due course. Green zone म्हणून this काढले मरे. So we are facing this problem because of mismanagement somewhere at their end.
They are indeed making up money on ventilators.
And Rahul had already pointed out in one press conference here long back that even ventilators made was at a very inflated price. Today you media are only telling that it has been a big scam and corruption. So even in pandemic corruption, जाल्यार कितें उरला?
So how you differentiate between the private hospital and the government hospital regarding COVID cases?
Private hospitals have stepped in now. Government has been doing right from the beginning. Now the very fact privates have been roped in is because the government has not been able to handle. आम्ही सुद्धा मागिल्ले की इवन प्रायवेटाक तुम्ही टेस्टिंग फॅसिलिटी द्या म्हणून करपाक टेस्टिंग because the government is falling short. Now it is happening very slowly. Decided cases are rising, action and reaction to that is very slow because again you don't have a proper government, you don't have a proper department that can respond to this crisis. This is a crisis. It is acknowledged as a disaster. So you require some kind of extraordinary measures, and most important is you require honesty and integrity in dealing with this and a good intention. All these things are missing from the government.
Our own ministers are going to the private hospitals. So that's a very clean indication.
Yeah.
So media bulletin, how is it for that?
Media bulletin.
Media has
ताचेर ऑलरेडी तेज्या आंकड्याचेर आमी पयलेच ऑब्जेक्शन घेतिल्लें दॅट द फिगर्स आर नॉट इंडिकेटिंग प्रॉपरली. वी नो दॅट देर इज लॉट ऑफ सप्रेशन, statistics are not, they are all fudged, figures are not brought out properly because they have a lot to hide. Media also should